MMT Cervical rotation. See your text for a complete list of muscles. Patient position. Assist the patient to the supine position with the head supported on the table. The arms are at the side. Position of the therapist. Stand at the head of the table facing the patient. Passively take the neck through bilateral cervical rotation by cradling around the occiput. You are not assessing the infield. You are determining how much range the patient is able to rotate the cervical spine so that you can appropriately assign a muscle grade. After assessing the available range of motion, position the patient in either right or left cervical rotation. The position depends on which cervical rotators you are testing, the left or the right rotators. To test left rotation, position the patient with the head rotated to the right. In patient-appropriate language, ask the patient to bring the neck to neutral from the rotated position. Common substitutions include coming out of the plane of rotation and any extraneous trunk motions. Please note that it is not necessary to have the patient perform the active motion twice if no substitutions are observed on the first attempt. You may apply the resistance at that point. After correcting any substitutions, reposition the patient's head. To test left cervical rotation, position the patient in right rotation. Ask the patient to bring the neck to the neutral position. Place one hand near the base of the head. With the other hand, apply resistance over the side of the head above the ear. Apply resistance in the direction of right rotation. To test right cervical rotation, position the patient in left rotation. Ask the patient to bring the neck to the neutral position. Place one hand near the base of the head. With the other hand, apply resistance over the side of the head above the ear. Apply resistance in the direction of left cervical rotation. Apply the force for a 5-second count. The force should not be jerky or sudden. It should be a gradual increase until maximum force is applied. Always consider the muscle shape and size you are testing to help guide you with the amount of force you are applying. Assigning a grade. Grade 5, normal. The patient completes range of motion from cervical rotation to neutral and holds against maximum resistance. Grade 4, good. The patient completes range of motion from cervical rotation to neutral but breaks against strong to moderate resistance. Grade 3, fair. The patient completes range of motion from cervical rotation to neutral but does not tolerate any resistance. If these conditions are not met, the patient must be repositioned to a gravity-eliminated position. Assist the patient to the short sitting position with the head in neutral. Stand in front of the patient. Grade 2. Reassess the patient's available range of motion in the sitting position. Instruct the patient to keep the head in neutral and to turn the head to one direction. Come back to the middle, turn in the other direction, and come back to the middle. Observe for any deviation from rotation. Grade 2, poor. The patient completes partial range of motion of cervical rotation. For Grade 1, maintain the patient in short sitting. You must now palpate the sternocleidomastoids by placing your fingers over the muscles near the insertion at the mastoid process. Again, ask the patient to attempt cervical rotation. Grade 1, trace. Palpable contractile activity with no movement. Grade 0, no palpable contraction.